Hey, everybody. Welcome back to the Energy MD podcast, where we are on a mission to help 1 million people increase their energy naturally by addressing all their root causes so that they can have more fun and success in every aspect of their life. So I'm really excited today because we're going to be talking about, is it brain fog or is it ADHD, with the expert herself, my friend, Roseann Capanna-Hodge. And so let's learn a little bit about her. Let me grab her bio. So, a mental health trailblazer, founder of the Global Institute of Children's Mental Health and Dr. Roseann LLC. Roseann is on a mission, Dr. Roseann is on a mission to change the way we view and treat mental health, showing people it's going to be okay with science-backed tools that improve well-being. That's also the name of her podcast, right? That's the podcast.
It is.
It's going to be okay. I love it.
And I got a book.
And the book. She is known for teaching how to calm the brain in order to have a happy family and give the keys to unlock the brain's potential. With her trademark method, BrainBehaviorReset, she has helped thousands address the most challenging conditions such as ADHD, executive functioning, anxiety, OCD, mood, Lyme, and PANDAS, using science-backed holistic therapies. She is an author of 3 books, including her most recent book, It's Gonna Be Okay, and is a media personality who's featured on dozens of media outlets. Dr. Roseann, thanks so much for joining me today.
Well, I love your mission. I love that you're helping people who are impacted with things that affect their energy. And, we share so many of the same clients. I work with a lot of younger clients, but also adults. And many times people's brains are affected by infections and toxins. And in their health journey, they find us, and they get better.
Absolutely. Yeah. And it's, I talk a lot about the causes. And so I definitely want to get into those with you. But let's first define some of these terms. We're talking about brain fog versus ADHD. How do they differ? How are they similar?
Yeah. So let's talk about brain fog, right? So brain fog is something everybody knows exactly what it is, right? They know how it feels, right? So when you think about brain fog, we're not going to talk about the root causes right now, but we'll save that. It's when your brain is having a hard time doing things easily, right? Where it feels like, ooh, maybe I felt like I didn't sleep, or it feels a little muddled and you're struggling, right? But your normal brain state is pretty much a healthy brain state. Or maybe you already have something else and you feel like it's even harder to focus, right? I always kind of explain it to, like, when I work with parents, I'm like, it's like when you just didn't sleep. That's kind of that feeling of brain fog. Like everything feels like a little out there, right? Like you're underwater almost, right? Where ADHD is a clinical condition. The symptoms must show up before age 12. And what are those symptoms? So struggling with impulse control or hyperactivity, attention, and really self-regulation of your thinking and attention systems, and potentially your behavior if you have issues with self-regulating and being impulsive. And impulsive doesn't have to be, I was explaining to a mom today, it doesn't mean when you think of an impulsive person that this is somebody who's like obnoxious or pushing things over or verbally impulsive. It also can mean that you're just having trouble self-regulating cognitively, like switching gears. But ADHD is a clinical condition. We know what it looks like when it comes to brainwave activity. And I have to say, because I do QEEG brain maps, which is a way to look at the health of the brain, tells you what's overworking and underworking. And when you look at the brain, somebody with ADHD looks different than brain fog. So ADHD shows way too many unfocused brain waves and not enough focus. Typically, a straight brain fog, we'll talk about some of the sources. What you're going to see is just a lot of unfocused activity, and you can see normal focused brain waves. So different patterning when we dig in.
Mm-hmm. Interesting. And so you said that it's got to happen before the age of 12, right?
Yes.
So then there's a lot of people talking about it as adults now, adult onset ADHD. How does that come into play?
Well, Evan, I talked about this with you before. I am seeing this is a conversation that everybody is talking about, because during the pandemic, I got so many adults who were like, I think I have ADHD. And when you sit down with them, you know, sometimes we may not be diagnosed until we're an adult, but the symptoms were already there and we were compensating, right? So the difference is that when it is ADHD and it's a true condition, a clinical condition, there would have been some symptoms. Like when I sit down with somebody and I say, you know, do you remember having a hard time at school? Like, do you remember getting in trouble? Do you remember turning in your homework last minute? Have you had difficulties because your partner tells you never listen? You know, like there's some kind of effect academically, at work, or in relationships, and all three, right? So when it comes to having a difficulty focus, right? I see it as way more of brain fog. And even the next level of that, like, why is this brain fog happening? Right.
Mhm.
So could it be that you already had ADHD, the social isolation, infections like COVID? We have a huge rise in strep right now. Just everyone being bombarded with different things. Of course, all our tick-borne infection peeps. There's so many reasons you could be having a hard time being focused, and it's not always ADHD. And I always say that anybody who comes to me who says they have ADHD at every single age level, at a minimum 50% of the time, it's something else. And you have to look at what else are some of those things. And some of them I already mentioned, but we can dive into that a little bit.
Yeah, and my question is always, is the treatment going to be different? You know, if you're looking at the causes and you're looking at a lot of different root causes for brain fog and for ADHD, do they have similar causes? And then consequently, is the treatment going to be the same or similar?
Yeah, no, in fact, causes can be vastly different of focus, and the treatment can be very different. I mean, the base of my work is to calm and regulate the brain with brain-based tools as well as lifestyle, right? You know, diet and looking at nutrients and all these other things, moderating stress. And I think that's the same no matter what. But then if it's Lyme, it can't be the same thing as OCD or an anxiety disorder, right? So the getting to the root causes is really critical. And it's often why so many people feel that, well, you know, Dr. Roseann, I've tried a lot and I'm just not sure I want to come to you, you know, because I get it. You've tried a lot, but if you're not addressing the right issue with the right treatment in the right order, you're not going to get better.
Right.
And in fact, some of the things you may have tried might be appropriate, but something else needed to happen first, right? So like a perfect example of that is I work with a lot of people with obsessive compulsive disorder. And I mean a lot of kids and teenagers and young adults, right? Though that's really our kind of one of our specialties, because we work with people with PANS and PANDAS, and it's just a very high co-occurring condition. So we had to get awesome at OCD, right? So somebody who comes to me with OCD and their source is COVID, right? True story, happens all the time. How can I treat that the same as if somebody has OCD because it's genetic OCD? It's
Mhm.
not the same treatment. You have to go through, why is this person having an autoimmune response to COVID? Like, what is missing? Is it the nutrient levels that are affected? Or it's always going to be that they're not detoxifying, like 100% of the time. Maybe their sleep is impacted. So we have to, I always say, take a 360 aerial view. We have to look at the ecosystem and find out what are all those pieces, because as much as everybody thinks they're going to come to you and I, and there's going to be one miracle, it's not the way it works.
Right. Yeah.
And you have to look at all of it. And instead of feeling upset by that, I say, flip that script, be empowered by it. You have
Right.
lots of ways to skin that cat. Like there's a lot of ways to get amplification, to get improvement. So yes, you treat things differently. That's why identifying root causes and really checking under the hood and doing those diagnostics are really important. And that's why expert care is very different. When you go to somebody who isn't an expert, they're like, they don't know what they're doing, and so it's just so different. I say you wouldn't get your heart checked by a foot doctor, right? Just wouldn't, of course. But why is it these other things when you're in a chronic, state?
Yeah, I couldn't agree more. Oftentimes I'm using the piano example. Like if you want to learn how to play piano, you ask a piano teacher, right? You're not going to go and ask somebody who works on your car, right? You're going to ask them to fix your car. And so
Right.
it's the same exact thing. If you want to fix like fatigue with me, ADHD, OCD, all the stuff you do with you, right? You want somebody who's in it all the time because then they've
That's
seen
right.
all the nuances, because a lot of it is the bumps along the way that you don't know are going to happen. You need somebody who's seen them before and can tell you what's going to work.
Right. I mean, and really, what they're bringing to the table. I mean, this is my 31st year in mental health. So, everyone always comes to me and I do the brain map, and then we sit down and they go, "Is this the worst brain map you ever saw?" And I'm like, "No." But you get the benefit of all the other ones, right? And it's just I only use science. Like I dissect everything by science. And that is why you have to get to the root cause. And I think, certainly in mental health and certainly in medical health, medical support as well, we're not thinking like that. We're not thinking like, how is everything connected? And so people in this world, in this pandemic, when we bring it back to ADHD, they're like, I must have ADHD. I mean, you can have adult onset. Well, you can't have adult onset. You can get adult diagnosis. And so we got to look at the history. And then if you are struggling with focus, what else could it be? Right? Do you have long haulers? Was it a tick-borne illness? So I like to start with illness. If something went down, of course, I want to find out if there's a situational stressor. Like, I recently had a client who's doing really well, trauma background, doing neurofeedback. And he was like, Dr. Rowe, I'm feeling a little sad and I don't know what's going on. And I was like, it's going to be Mother's Day next week. They're like, And I was like, all your trauma's around your mother, honey. No offense. I don't mean to sound like a psychologist, but the brain picks up on stuff. And I was like, what, gotta work on it, So sometimes we have to look at like, is there really some kind of stressor? Because stress can make you feel like you're ADHD. Who hasn't experienced that in their life? Whether you're a college student and all of a sudden, you have a million exams and you're like, I can't focus on anything but studying, like, right. Or you just had a baby, whether you're the dad or the mom, and like you have a baby brain. My best friend Shelly is pregnant, and I was telling the office right today, she's in the first trimester, and we're super sarcastic and crazy silly with each other. And I was like, Shelly, I wasn't going to tell you, but you have the worst pregnancy brain. You can't remember anything, And she was like, and in the office, they were like, you're so terrible to tell her that. I was like, that's our relationship. But she was like, I totally do, Ro. Thanks for being the only person that would tell me that, So she doesn't have ADHD. Like, she just, her hormones are off. So, hormone changes. I mean, talk about that. So hormone shifting, men and women, we never talk about male hormones, but I get a lot of males in their 50s coming to me thinking they have ADHD and they were never diagnosed with it. I get a lot of concussion, birth trauma history. And sometimes when the hormones shift in their 40s and 50s, then the way their brain was compensating was no longer can compensate. We need hormones for memory. And when your memory goes down, you can confuse it as an attention problem. But I think the biggest thing that I see besides infections causing brain fog, causing attention problems, is probably straight old clinical mental health issues, depression, anxiety, stress. We want to think you can function because you have been. And we want to think you can keep going at a high level, sort of like alcoholism. At a certain point, your body can't handle it. It's the same thing with those clinical issues. Most people with clinical mental health issues function and they're working and they're in relationships. It may not be going great, or you might be a hot mess on the inside, but you can't just push and push and push. When I see a brain map, I see hyperconnectivity, lots of anxiety, a lot of overprocessing. And, you know, you have to be kind to your mind. And if you're not, it's going to start, you know, not working as well. And attention and brain fog are some of the biggest issues that I see.
Yeah, I want to get more into that, being kind to your mind. But before we do, one of the things that I see is with chronic fatigue syndrome, with long COVID, is that we're looking at over 30 causes, but there's always like a combination of about 20 of those causes. But if we find those causes and we fix them, then the symptoms go away. I wonder how much of that happens with mental health. How much is genetic? How much do you see as environmental, whether it's the hormones or deficiencies in nutrients or the infections, molds, whatever? What are you seeing with those? Can you really get rid of those causes and fix somebody's depression or anxiety or OCD?
So 100% you can fix them, right? Again, it is a multi-pronged process. There is no magic wand. And you have to use science. We have to use what we know about the brain, what we know about the body. And guess what? The person I'm working with, the child, the family, they got to work. Like this ain't like, you know, so, you know, every week somebody flies into me, you know, and sometimes I treat all kinds of people, right? But there is no magic wand, but let's back that up, right? So you have to identify the right things. And I know that the majority of people I work with have infections, have toxins impacting their brain. So I start with a QEEG. And when I see, because I now, you know, I can interpret these at a very high level. I've done well over 10,000 of these. So when I see it and I see Lyme, right? And I have 100% accuracy in Lyme, I send them to a physician. So I'm not a medical doctor. And then I'm like, you've got to treat the infection, right? But then what happens in 100% of the time, no matter what the source is, genetics or whatever, I have a dysregulated nervous system. And so if the nervous system is dysregulated, what we know from science, the study of stress is called psychoimmunology. And psychoimmunology tells us that when the body is in a stress state, it's almost impossible to the body for it to heal itself. If it does try to heal itself, it's not going to do it in an optimal way, right? So I calm the brain, right? Calm brain, happy family. So I calm the brain. You work with a medical provider to treat the infections. But then when it comes to toxins and infections, what happens? You know the answer to this, Evan. It wakes up all the genetic snippets. Like our epigenetics are things that are potentials that may or may never happen. But sadly, things like, you know, Epstein-Barr, COVID, you know, herpes 6, Coxsackie, mold, you know, all your, you know, Bartonella and Babesia, the two double B's of trouble in the world of mental health, they really can wreak havoc. And then on top of it, if almost everybody's got MTHFR, you're not detoxifying, right? So you have this cascade of stuff, again, that feels very overwhelming. But when you work with people like us, we know how to unravel it. And then in my situation, when there's a mental health problem, first you have to regulate the nervous system, and then you have to do coaching or therapy. Like, you can't ignore the behaviors. Like my OCD people that have PANS or PANDAS, right? So strep or variety of infections. So strep is PANDAS, PANS is any infection or toxin. A lot of times they're like, well, I'm going to the best doctor in the world, Dr. Rowe. And then I'm going to go do neurofeedback or PEMF with you. And I don't really want to do therapy for OCD. And I'm like, listen, it's the way the brain is. The brain, it's a habit in the brain. You could want all you want. Your brain's going to keep doing the OCD looping. So let's do it. Let's get it done, you know? So I had a mom this week. She was in this situation and she's so lovely. And they're a Jewish family. And what do Jewish families do in the summer? send their kids to camp
Summer
for
camp.
the whole summer. And she was like, I want to do this, but I want to go to summer camp. I want him to go to summer camp. And I'm like, listen, sorry, like this is, it's like if he had cancer, you wouldn't think about it. You'd have to do the chemo. Like we got to do it. And I was like, I hear you. Let's have a short-term pain for a long-term success. So she heard me and she's doing it, So nobody likes to be derailed. And please know, everybody, I'm a special needs mom ×2. I have a child with remediated dyslexia and I have a child with PANDAS, with tick-borne infection. So, hey, do I like that? I had to homeschool my kid with PANDAS. I had to do all that. No, but this is what we did, and we made the best of it, and we move forward. And whatever you can do to really get to those root causes, lower stress, regulate the brain, that is how you lick these things. This is how you not just like be okay and manage it. This is how you thrive and get on the other side of it.
Amen.
That's important. Yeah. Amen.
The other thing I want to talk about that you touched on is the difference between diagnosis and causes, because a lot of people, they kind of latch on to diagnoses and they're like, okay, I've got this ADHD diagnosis, I've got this OCD diagnosis. Can you talk a little bit about the difference between a diagnosis and a cause?
Yeah. So, I mean, we have, our system is set up in a medical model, right? And it's very much ruled by pharma, right? So every diagnosis leads to a pill. Okay. That's the way it is. It is in mental health. It is a way in physical health. And what we have to do is say why, right? So when we talk about symptoms, and please know, you don't have to have a diagnosis to get treated. If you have a symptom, don't ignore it, right? But just because you were diagnosed, most people come to me with shopping cart diagnoses. So their mental health, they're like, I have a history of social anxiety. I have disruptive mood disorder. Now they told me I have OCD and oppositional defiant and ADD. And I'm like, okay, that's called a dysregulated brain, right? So you have internalizer and externalizer symptoms, right? Then what I do, because I'm so like, Evan heard me give my data speech before here. Like what is the greatest pain point? Like, where do I got to hit first that's going to have the best relief? You need relief, right? And that's so important, but we can't get hung up on that diagnosis, because the person that you probably got your diagnosis from, you're here with Evan and I because you didn't get better. And so the diagnosis is just what their training is. So I and Evan, we've been trained traditionally, and we chose to do functional training. And functional training is all about connecting the dots, right? I always think of I know I'm a mental health detective. So I had to get involved in medical. I've only been integrative because I only had complex cases right out of the gate. And so when you work with the most complex cases, kids in psychiatric facilities, you quickly realize that psych meds and talk therapy doesn't work, right? I should use a bunch of words that are 4-letter words right now, but I'm not. But it doesn't work. So I don't believe that. I believe that everybody can get better. I don't believe that you can't. The degree of getting better, that's just unique to what's in that person's body, what their spirituality is, what their mindset is. The more spiritual my clients are, the better their outcomes, independent of the condition. Like, the worst cases I have, the more spiritual they are, the progress is immeasurable. Please know that. It's pretty incredible, actually. And so we have to start really thinking differently, and we can't just say, well, this is my diagnosis. And people are here. Like I recently did a like a live because somebody who provides a service to me, I came in and I was like telling them like, oh my gosh, this Hollywood producer called me and they want me in this major docu-film that's going to be on, you know, HBO Max on natural solutions for ADHD. And I said to him, he said, can you talk about that? And I was like, 1,000 times yes, I can talk about it. I was like, have you seen my work? So, and he knew, but it was pretty amazing. So we talk about it. And the next thing I know, they tell me that they put their kid on medication. And so this is something I've known a long time. And the first words out of my mouth were, you're going to damage your child's brain. And they got very upset with me. And I said, listen to me, you asked me my opinion and I'm going to give you my opinion. So they then said, well, how do you know this? And I was like, do you not follow me? Do you not read my stuff? So I literally sent them quick, here's the blog on this, here's that. And his response was, I did it because I had no choice because the teacher was putting so much pressure. I get it. So then I said, listen to this episode of Gail, because she was in the same situation. And, you know, but he said, why doesn't the neurologist tell me about like diet and this and root causes? And I said, honey, they just don't, they've chosen not to get the training. So, you know, so I encourage them to go to an integrative person. I said, here's what you want to do. We want to check. We didn't even talk about nutrient levels and, you know, things like that. Sometimes you could be obscenely low in 1 or 2 nutrient levels, and it could cause massive cognitive issues. Right. So there's just a lot of things that could be done before we get to psychiatric medication. I also want to be really, really, really clear that the research, and in my book, it's going to be okay. There's a January 2021 study that people that have infectious disease have very poor responses to psychiatric medication and have a very high rate of side effects. So, so we want to be mindful about, you know, treatment does not have to be psychiatric medication. Treatment should always start with, why is this happening? Right? So that we can get to the right treatment. And a pill does not, most people realize, Evan, when they get to me, the pill doesn't fix it. You gotta work on the behavior, you gotta work on the mindset, you gotta have lifestyle. You're not gonna eat Cheetos and not have brain fog.
Right. You can get away with that for so long. And then
I don't know anybody who gets away with it, you know.
Teenagers.
The good thing about me, if I eat anything disgusting, like I feel it immediately, you know, like I'm like, oh God, why did I do that? You know, but at the Cheetos people, when somebody finds me dead by my car, it's whoever owns, it's Frito-Lay.
So let's talk about therapy. You kind of alluded to treatments and therapy a little bit. I know you got a lot of different tools in your tool bag. What are your favorite tools that you use for these mental health conditions?
Yeah. So I work on calming the brain and then resetting behaviors. When it comes to calming the brain, I love neurofeedback. I love PEMF. We've even developed our own PEMF device specific to infections and toxins. Pretty cool. I actually have it right here because I do on my podcast. It's a little device. And I custom designed all the protocols. It goes through, there's a brain fog one on there. There's things that are very specific. But these things are designed to support the nervous system in regulating, and neurofeedback directly trains brain waves. And we work with people remotely all over the world. I also love biofeedback, you know, things like heart math. They're just unbelievable. I mean, they really help people so much. And again, you're putting your body, unless it's getting into a parasympathetic state, all of the body's resources are going to try to find out why it's so activated, particularly for people that go into a very hyperactivation or a fight, flight, or freeze state, which can happen to very young children. It can happen to anybody. Compounded stressors, infections can move the body. So we get it into a parasympathetic state. Doesn't even have to be perfect, but we create wiggle room so you're not in this complete activation, because if you're in there, you don't have control over your brain. Like, you're not going to be able to think. Talk therapy is almost a waste of time. So then I believe in very specific types of psychotherapy once you're regulated. So you have OCD. What's the treatment for that? That's ERP. You have trauma. You're only going to do trauma therapy. You're not going to do talk therapy. You're going to go to a trauma therapist. So that, and you got to change behaviors. You can't say I'm anxious and I do X, Y, and Z. I'm going to take Zoloft, but I'm not going to change X, Y, and Z behaviors. What are the healthy behaviors that are going to come in? I mean, it's got to be diet. It's got to be lifestyle. It's got to be, learning how to set boundaries with healthy, with toxic people, being kind to your mind so you're not so negative. You have to make changes, and they start out small so they don't feel so heavy. And once your brain knows it's making these changes, it becomes easier, it becomes lighter. So, mental health can change. I have the privilege of helping people every day completely change that, script that it's, oh, you got to have OCD for the rest of your life. Oh, you got to have anxiety for the rest of your life. No. So, but if somebody comes in here and thinks, hey, Dr. Rowe, I'm only doing this, I'm not doing any of the other things. Well, first of all, we don't accept you, but it's not the way, and stress is always there. You gotta find a way to counter it. That's for you, like I just did 2 endings in our 6-month program. And I was like, here's what I want you to do forever, and I laid it out for them. And one was heart math. Like, I was like, I want you to do heart math. And then I was like, you've benefited so much in your brain from doing the probiotics. Let's make sure you continue it, switch between these two, it can be those kind of levels of things. And this was a family that also really worked on trying to control their stress. So we laid out some of the things that they behaviorally as a family needed to continue doing. And I was like, how do you feel about that? Do you feel like you can manage that? And they're like, yeah, because it's been helping. Like, good,
Brilliant. So you have a free gift for our audience. It's the quiz, right? ADHD quiz.
Yes. So you can go, if you want to know if it's ADHD or something else, you can go to www.drroseann.com / is it ADHD quiz.
We'll drop it. We'll drop the link below. Yeah.
Yes, please do.
And then best place for people to find you, learn more about this amazing work that you're doing.
You can just go to www.drroseann.com. And my podcast is there. My book is there. It just has all the resources, and lots of blogs. I love to write. So I make it a resource hub for people.
Brilliant. Dr. Roseann, thank you so much for joining me today.
Well, thank you for this conversation. And, if people are struggling with ADHD or brain fog, take a step towards changing that.
Amen. Reach out to Dr. Rowe. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.